tonight.
I was tired, I was weak, I had trouble getting up and just walking around the house. It was an effort.
He was gray, sallow, his face was sunken, he lost weight.
An ABC 27 special presentation.
He was getting frequent infections of the liver that led to the need for both the kidney and the liver transplant.
Transplanting Hope, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. April is National Donate Life Month, a time to celebrate the people who choose to give the gift of life. This is a special show about transplanting hope. Liver transplant surgery is the second most common transplant surgery in the United States. Now there are nearly 17,000 people waiting for a liver transplant. Each year, Penn State Health does about 30 liver transplants. What determines when you get a liver transplant? Can you return to work after the surgery? And how do you become a donor? You will find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Christina.
Hi, Deborah. Specialists from Penn State Health, Milton S. Hershey Medical Center are here in the ABC 27 call center this evening. They will be answering your questions through 8 o'clock. Call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Doctors Asha Kumar Jain and Fazia Butt will answer your emails throughout tonight's show. All calls and emails are confidential, and I will be back later in the show to share some of those questions with you. Deborah.
Thanks, Christina. A Lackawanna County couple celebrated 34 years of marriage. Karen and Gary Rodolfi never realized the true meaning of the vows in sickness and in health until 8 years ago. Here's their journey. Karen and Gary Rodolfi love to travel.
We go to Vegas a lot. We see the Phillies play a lot. I'm a big Phillies fan.
You get to meet different people, you get to see different places, different cultures. Everyone's different.
In 2010, the traveling stopped. Karen's health became the focal point.
Karen had a unique disease, not one that you're going to hear a lot of. She had something called sarcoidosis, which led to inflammation and scarring inside of her liver. We recognized the fact that her disease had progressed to the point of having cirrhosis in her liver. So when that developed, she was sent for an evaluation for a liver transplant.
News Karen and Gary weren't expecting to hear.
I cried. I cried at first.
We were really shocked when we walked out of that first meeting when they said she had to have a transplant. We were just blown away. Like, holy cow.
I think I cried that day and that was it. Just the initial shock of it. And then I was, okay, let's just do what we got to do and get this done and over with.
Karen and Gary met with Penn State Health's liver transplant team and decisions needed to be made.
We heard the living donor, like, oh, what's that? So I said, well, that's when we take somebody, we find someone who will volunteer, and we take half the liver out of their body and put it in the person with the bad liver. So how about that? So I'll do it. So what the? I'll give it a shot. See, we'll do a testing on and see what happens. If it works, great.
When Karen and Gary exchanged wedding vows in 1985, neither expected in sickness and in health to mean a life-saving liver transplant.
I never even thought of him, to be honest, because I'm thinking family. And he said he wanted to be the first one tested. And he was.
We actually put them through quite a lot of testing.
So they started testing me, I'd say in November of 2010. First it was a simple blood test to make sure the same blood match, and that matched out well. Then they did a myriad of blood tests.
They have probably 18 to 20 tubes of blood drawn, looking for any disease you could think of, any reason their blood clots too much or doesn't clot enough, making sure their kidneys are good, making sure their cholesterol is good, making sure their liver works well.
While Gary was tested, Karen's health declined.
When I did start going downhill, I felt like I was going downhill fast.
She started turning yellow, like really dark yellow. She was getting sick, really fatigued, really run down. She was starting to throw up a lot.
I had no problem sleeping. Like I said, I threw up a lot of bile. I didn't have much of an appetite.
5 months after Karen was told she needed a liver transplant, she received the best news ever. Her husband was a perfect match.
He came up as an appropriate donor for her. So we went ahead and proceeded with it.
I said, well, how does it look? Is everything in line? Are we going to be able to do it? Well, yeah, I think everything is going to be fine for you. So, oh, good. So once I got that, I was like, oh, thank God, problem solved.
I was excited. I was actually excited. I'm like, oh God, finally.
He had sufficient left liver to give to his wife, which is actually a better option because you take a smaller volume of liver from the donor. So it was only 40% of the total liver volume as compared to a right liver where you have to take 60%.
A surgery date was set.
I wasn't nervous in any way. Just got ready to go, and I got my medications. And I remember seeing her as they were wheeling me back, and I told her I have no regrets, no regrets.
It was emotional because how many guys do that? Do you know? I mean, like, it's pretty scary. And they say it's worse on the donor than it is on the recipient.
Basically what happens in a live donor liver transplant, it has an extra layer of complexity because you have 2 operating rooms. You start with the donor, you evaluate the donor's anatomy, you then divide the essential structures, prepare the donor, and the recipient is being operated on in a separate room by a separate team of transplant surgeons. And once the left liver is taken out, it's prepared in cold solution and ice where it's flushed and then brought over to the recipient room, and it's implanted then in Karen once her liver is taken out and removed. It went extremely well. Their operation went very smoothly.
And a smooth recovery for Karen and Gary.
I was sore, but not in pain. You could feel a tightness in your stomach area here, but I wasn't in pain.
The recovery wasn't as bad as I thought it was going to be. Like, I couldn't go out for a while. If I did, I had to wear a mask.
Now, 8 years later, Karen and Gary are happy and healthy, and the transplant surgery is a reminder of what brought them closer.
I feel like there's nothing we can't handle. I mean, that was a major thing we went through. Like, there's nothing I'm not going to be able to handle.
Oh, she's doing fantastic. She's doing really well. Yeah. Since she had the surgery, different attitude, more positive.
It's amazing. For such a scary situation, it turned out to be positive for me, as crazy as that might sound. Like, it made me appreciate things more.
By sharing her story, Karen wants others to realize the importance of being an organ donor. And joining us right now is Zakia Kadri and Karen Kroc. Thank you for being with us. What a love story between Gary and Karen. The live donor program is unique to Penn State Health. Tell me about that, Dr. Kadri.
Yes, we're the only UNO-certified live donor liver transplant program in central Pennsylvania. There are very few certified live donor liver transplant programs in the United States. It requires expertise in both liver transplantation and hepatobiliary surgery. It's a very complex procedure, and it's very well suited for an academic center with multiple specialties supporting it.
And Dr. Kroc, what does it take, or what is the criteria to be a live donor?
So first off, the donor has to be of excellent health. Not too young, so not younger than 21, but not too old. Usually 65 is our upper age limit. They can't be overweight. We usually use a body mass index cutoff of about 30. And we do expect some kind of relationship between the donor and the recipient before they undergo this major surgery.
And we know that there is a very long waiting list. So how do you become available or ready for a liver transplant?
When you have end-stage liver disease, you're listed based on the severity of your liver disease. And the severity is reflected by the MELD score, which basically calculates various components of your lab work that indicates how bad your liver disease is. As you get higher and sicker on the waiting list, that's what determines when a liver is allocated to you. Live donor liver transplantation actually complements this in the sense that we do have patients who have severe liver disease that's not reflected by their MELD score, and those are the patients that really benefit from a live donor liver transplant program. The second category, I would say, is patients who are very small, like Karen Rudolphi, who would have difficulty finding a liver allograft that is small enough for them and not too big that could be fit into them. And they also benefit very well from a live donor liver transplant.
And Dr. Kroc, what a difference being a live donor is. Look at what happened with Karen and Gary. What a happy ending to their story.
Oh, absolutely. It's just an absolute pleasure to see them in the office every year, to see Karen working, and to see her husband right there by her side through all of it.
Thank you both for being here. Dr. Kadri, we're going to talk to you in a little bit, but Dr. Kroc, thank you for spending the time with us.
Thank you very much.
Let's check in now with Christina Butler in the ABC 27 call center. How are the phones there, Christina?
Hi again, Deborah. The phones really are ringing over here, and a reminder that you can call in with your question. The number is 717-346-3333. Here to answer our viewer questions tonight is Amy Wilderson, Living Donor Transplant Coordinator.
Hello.
Thanks for being here. Here's our first question. They want to know, my doctors have let me know it's possible I may need a transplant down the road. Is there a typical wait length, or how should I prepare to be on a wait list?
There isn't a typical wait length, but you can prepare to be on the wait list basically by keeping yourself healthy as possible, taking your medications, coming to your appointments, exercising when you're able. The stronger you are pre-transplant means a better outcome post-transplant.
Okay. Amy, thanks so much. We'll check back in with you in just a bit. And as a reminder, as we head to break, that you can call in with your questions, or you can email your questions to questions@abc27.com. Stay with us. We'll be right back.
You're watching Transplanting Hope on ABC 27, sponsored by Penn State Health Milton S. Hershey Medical Center.
Welcome back. A Cumberland County man is thankful to be alive. Joe Gargiulo has a disease that attacked his liver and his kidney. Here's his journey. Joe Gargiulo is a musician. He sings and plays in a band.
When I retired, my daughter bought me a box of clarinet reeds and said, "Dad, you need to start playing again."
He does great. He's professional quality. He plays for shows, like musical shows. He plays in church. He plays with 2 clarinet groups. He plays with our local New Cumberland Town Band.
A man who doesn't know when to stop, except when his health leaves him no choice.
I inherited a disease called polycystic kidney disease. We didn't know much about it. My father died from it in 1956, and I was only 6 years old at that point.
In Joe's case, he had both the liver and the kidney cysts that over time led to his kidney to fail first, and then eventually also led to the liver problems as well. He had a second problem of his liver as well. It was very complex, but he had a drainage problem of his liver as well. And between the 2 problems, he was having recurrent infections of the liver.
Doctors said Joe needed both a kidney and a liver transplant. But before he could be added to the transplant list, doctors needed to evaluate him.
He went through a very careful medical evaluation, including heart checks, kidney checks, lung assessments, and psychosocial assessment. And at the end of that time, we did make the determination that Joe could get a good result with the kidney and liver transplant.
I remember at that time his wife wanted to donate both the liver and the kidney for him, and I explained to her at that time that we would not take both organs from the same donor for the recipient, because we work towards donor safety.
Devastating news for Deb and Joe, especially since she was a match.
That week that we found out, that was really hard. And I just went back into my praying mode, hoping that, somebody would be generous.
In the meantime, Joe's health declined quickly.
I was tired, I was weak, I had trouble getting up and just walking around the house. It was an effort.
He was gray. Usually people with liver issues get a little yellow, sallow. His face was sunken. He lost weight.
He was critically ill. He had received multiple hospital stays. Several of them were life-threatening infections.
This was hard to wait and wonder. And I would just pray to God to, get me up in the morning, get me going, make the coffee.
7 months later, Deb and Joe's morning became so much better.
So in April of 2009, it was actually on Good Friday.
He was transplanted with a kidney and a liver, which was such a blessing, really.
A blessing and a bitter understanding of the life-saving decision the organ donor's family made.
In their worst moment of their lives, knowing that their loved one is dead or dying, they're thinking of me and my husband and all the other thousands of people hoping and waiting.
A member of my team goes and procures the liver and kidney, so they are obtained from the same donor, and brings it back, and we go to the operating room with the recipient. We start off with the liver transplant, we complete the liver transplant, and then close and proceed with the kidney transplant.
A very long but successful surgery.
The kidney started functioning right away, and the liver was functioning right away too. My color came back, my liver numbers are better than the doctor's liver numbers. I mean, I'm golden, but I was wiped out.
It went very well. He had a standard stay and then left the hospital, and he's been well since.
It took about 6 months for Joe to get back on his feet, and he hasn't stopped running.
I'd say just a couple of months, he was back to wanting to eat everything he could and doing everything.
I have been healthy and active and busy since 2009.
His liver and kidney are working absolutely perfectly, and there's no end in sight in how well he can continue to do. And his prognosis is continuing to look quite favorable for many years to come.
He's doing great. He's a busy person.
I felt back to my normal self, walking, starting to play my clarinet again, doing more singing.
He does everything. We are so blessed.
Joe is an example of doctors giving him the health he needs to live the way he wants. Joe is forever grateful to the organ donor's family. And joining us is Joe's doctor, Thomas Riley, and Surgeon Dr. Kadri. Thank you for being here. Talk to us a little bit about we heard as far as what Joe's reason was for a liver transplant. What is the list of reasons?
Yeah, there are about 10 or 15 different causes or reasons why people need a liver transplant. But the most common of those is non-alcoholic fatty liver disease. That's related to the obesity epidemic. It's replaced hepatitis C, which was the most common reason for about 2 decades. But because we've been curing hepatitis C more prevalently, that's dropped on the list. And other things such as hepatitis B, alcohol, autoimmune liver diseases, genetic diseases such as hemochromatosis, and liver cancer, all reasons people get liver transplant.
So a long list of them. Now, as we saw in Joe's piece, it was a double transplant, so that must have been a much longer surgery.
Yes, it was. It's much more complicated when you have to do a combined liver and kidney operation. You're starting with the liver transplant, and during that time the recipient has a non-functioning kidney, and so you have to have intraoperative dialysis that is continuous during the surgery. And you really require an excellent team and support, and we have a very strong anesthesia team that is able to take care of these patients, and a very strong OR nursing team, other than all the preoperative preparation with the coordination and with hepatology. The surgery itself is longer. It's about 6 to 8 hours to perform the liver transplant, followed by another at least 4 hours to complete the kidney transplant, plus the preparation of the organs, not to mention the procurement of the organs also.
And he is certainly doing great. Now, there are a lot of people on this transplant list. What is the waiting list like, Dr. Riley?
There are currently 13,000 or more people on the liver transplant waiting list, and we do about 8,000 livers a year. And so it leaves a bit of a gap or a shortage in the number of people who are waiting versus the number of donors that become available. One of the ways at Penn State we're trying to shorten that gap is to provide live donor transplant, and that can bypass that waiting time by going directly to a family member or a friend to get that donor.
So I guess the push really is to encourage people to be donors.
Absolutely.
Okay, Dr. Riley, thank you. Dr. Kadri, you're going to stay here with us.
Thank you.
And let's go back to the ABC 27 call center. Christina.
Hi again, Deborah. You do still have a few minutes to get your calls in from home. Again, you can call 717-346-3333. The phone lines are open through 8 o'clock. If the phones are busy, you can email your question during the show to questions@abc27.com. We're back now with Amy Wildison, and here's our next viewer question. They would like to know, if you have a friend or family member with liver disease, how can you support them and possibly prepare to be a donor?
Good question. The best way to support a person with liver disease, and if they are on the list, is to come with them to their appointments. Okay. There's a lot of information in those appointments, and it really helps to have a second set of ears. As far as being a donor, the first thing you can do is call our number, and we'll do a brief health history to see if there's anything that would rule you out to be a donor. And then if everything is fine, we'll do a blood type compatibility check. And if that's okay, then we'll bring you in to have an education session with our surgeon, Dr. Kadri.
Wow, and we have some video we want to share with our viewers at home. This is video, it's of a flash mob at the hospital. Yes. And they did this to bring awareness to organ donation. It's kind of a fun way to bring attention to a serious cause. Why is it so important to have that awareness?
We really want to increase people's apprehension to being a donor and signing up to be a donor. It's so important. You can save so many lives by just, telling your family that you want to donate your organs, and just sign your organ donor card on your license.
Okay. And here's our last question for you. I know there's a lot of support for organ donation, but only about half of the people in the U.S. are organ donors. I'm somewhat fearful of being an organ donor. What type of reassurances can you give me?
Well, we can reassure you that first and foremost, we are here to help people. And so we will help you if you come into the ER, if you have any problems. But if something unforeseen happens and you can save a life, you can help a family just by being an organ donor.
Okay. Amy, thanks so much for coming in, for answering these questions tonight. Thank you also to our specialists who are here tonight answering your calls at home. Deborah, back to you.
Thank you, Christina. Joining us right now is Bill Council and his niece, Karen McKay, and his surgeon, Dr. Kadri. Thanks for being here. Bill, tell us, what was your situation?
Well, I had some blood work done, and it took several years to figure out what was going on with it. And when I was diagnosed in 2007, I had primary sclerosing cholangitis. It's an end-stage liver disease, and they don't know what causes it, and there's no cure except transplant.
And Karen, what was going through your mind? You were there when he found out this news.
We had several family members in the room when he was informed that a living donor would be his best option. And having been at the appointments that day, I knew his blood type, and I already knew I was a match for that, so I thought, well, I can do this. I'll check into it and go from there.
And what was your reaction, Bill, when she said?
When she told me that she was a match, well, to say the least, I was, I don't think my feet hit the ground. I was shocked because it was kept very quiet, and that's the way they wanted it to be. They just didn't want me to know too soon in case there was complications or anything like that. So I didn't ask any questions, and I just left it go in the doctor's hands.
And Dr. Kadri, this is where you come in. How bad was Bill? How badly did he need a transplant?
He was critically ill, and unfortunately, which is typical of primary sclerosing cholangitis, the severity of his liver disease was not reflected by his MELD score. And he had had several hospitalizations that were very critical with fever and jaundice, and with a very high risk of going into septic shock. So he really needed this liver transplant. And patients with primary sclerosing cholangitis can wait a very long time because their MELD does not increase sufficiently, and yet they're very critically ill. So live donor is really made for this indication.
So this was perfect for Karen. So how was the surgery? It's more complicated.
Yes, live donor liver transplant surgery is more complicated. It requires multiple teams. It requires 2 operating rooms. We typically start with the donor, and after the assessment of the donor, a separate team starts on the recipient. So there's a lot of coordination. We have, as I mentioned previously, very strong anesthesia teams, OR nursing team, and the communication is really important during the surgery with the families, because as you can well imagine, both Karen and Bill's families are all of them there waiting, and so we tried to make sure that we kept them updated on the progress of both.
And how was recovery for the two of you?
My recovery was really good, as Dr. Cadre had pre-warned me that I would feel good right away because the liver is going to start working. That poor Karen would be sick because they took the liver from her, and that was the case. I could see it from her.
My recovery was a little rough at first, as you can imagine, and coming out of surgery and having a headache and an abdominal surgery takes a lot to recover from. But I was in for a week, and then after that recovered at home and had a wonderful support team, which really got me through it, and took it from there.
This was 9 years ago. You guys look great today. You're feeling good?
Feeling great.
Okay,
Yeah.
great.
Yeah.
Thank you guys for being here and sharing your stories. We do appreciate that. Dr. Kadri, thank you for all the information
Thank you.
tonight. And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information, or if you would like to schedule an appointment with Penn State Health Liver Center, call 717-531-6092 or visit online at pennstatehealth.org/liver-center. Thank you for watching tonight. We wish you good health.